Hello all, this is Dr. Alsop, and we have finally reached our discussions of the muscles of the lower limb. So we're going to start with the most proximal muscles, and then we will make our way all the way down to the foot. And then we will have finished our time with the musculoskeletal system. Okay, so when we're talking about the more proximal muscles associated with the lower limb, we're really going to spend some time on the gluteal region. And we've all probably heard the glutes before. These are going to be in the posterior thigh region, specifically a bit sometimes considered more superior than the thigh, but it's certainly going to be crossing the hip joint, so playing a role there. All right, so we're going to talk about the three major muscles here. Here's what I'm kind of expecting you to get out of this video, so do make sure that you return to these learning objectives and make sure you can answer them in your own words. All right, so let's start with the big one, the gluteus maximus. As its name would suggest, it is maximal in terms of size, so it is the largest. It's also the most superficial. So this is going to be the dominant muscle when you're looking at this posterior hip region. It is going to have proximal attachments kind of throughout the hip region, pectoral girdle region. And it's going to have its distal attachment. Some of it's going to be on the actual femur, but its largest distal attachment is actually on this structure here on the lateral side of the thigh, referred to as the iliotibial tract or the iliotibial band. So you may have heard of the IT band. It is going to be portions of the fascia that surrounds the entirety of the thigh. It's going to be thickened in the lateral region, and it's so thick that in fact you're going to have some muscle attachments here, and you're going to have a big one with the gluteus maximus. This muscle is going to be innervated by the inferior gluteal or gluteal nerve, and so it has its own innervation separate from the other gluteal muscle. So this is important here, so you can actually differentiate between damage to the inferior gluteal nerve and the superior gluteal nerve. This is going to be a powerful extender of the hip joint. All right. It's not the only muscle that extends the hip joint, but if you think about if I'm sitting down and then I decide I'm going to stand up, it's that gluteus maximus that's playing the big role in terms of the powerful movement to allow me to extend the hip joint and be able to get up from, say, a squat position or a seating position. It doesn't do as much when I'm just standing up and not really moving and just maintaining the extension of the hip joint. That's going to be more of the hamstrings. It'll also play a role in terms of lateral rotation of the hip joint. Now, deep to the gluteus maximus, you will have the gluteus medius, which is intermediate in size as well as depth. It's going to be kind of in between the gluteus maximus and the minimus. And the gluteus minimus is going to be the smallest of the gluteal muscles, and it is the deepest as well. Both of these muscles are going to have their attachment, distal attachment, on the greater trochanter. So remember, you can palpate the greater trochanter on the lateral side of your hip region. So these are two of the muscles that are going to have their attachment on the greater trochanter, making it so great. Both of these muscles are going to be innervated by the superior gluteal nerve, so not the inferior like the gluteus maximus. And really, the major role of these two muscles are to stabilize the hip, particularly during locomotion. It doesn't allow for the hip to kind of sag on one side. It contracts and keeps it where it needs to be. And it does that by abduction, abduction of the hip joint, and it does play a role in terms of medial rotation as well. But really, these two kind of work together to allow for stabilization. So if we're thinking about a typical fully functioning gluteus medius minimus is where superior gluteal nerve. If you are to be walking and you lift your foot up on one side, the muscle, so say this is the left side here, this is the right side, and you're lifting up your left foot in order to, say, walk, the right side gluteus medius and minimus will contract to keep the pelvic girdle stable. But say you had damage to the right gluteal nerve, and so the right gluteus medius and minimus are not functioning correctly. If you lift up your left foot, like you can see here, but you can't effectively contract the gluteus medius and minimus, this would cause kind of a drooping or a sagging on the side that is on the side where you're lifting up your foot, because this side is not functioning correctly. And this is sometimes referred to as gluteal gait or gluteal gait, or a positive Trendelenburg sign. You'll hear it either way. All right, excellent. So some very important muscles. Those muscles are particularly large in our species because of our bipedal locomotion, allowing for us to be able to stay upright and to have some powerful locomotion that can occur, but in a bipedal stance. So do make sure that you understand the difference between, say, the gluteus maximus as well from the gluteus medius and minimus. And one of those is this. The inferior gluteal nerve innervates which muscle? Is it the maximus, the medius, or the minimus? And hopefully you remember really quickly that the answer is A. The gluteus maximus has its own innervation, which is the inferior gluteal nerve. I often think of these two together. They have the same innervation, which is the superior gluteal nerve, and they have the same actions and the same distal attachment. So these you kind of put together, and you can think of them as kind of one unit. Whereas gluteus maximus is kind of off doing its own thing in terms of innervation as well as actions, but is located in a fairly similar region. All right, thanks for your time and attention. Let's move on to the muscles of the thigh.